Good afternoon, everybody. I'm Zara Arboleta at Valley Children's Hospital, and thanks for joining us for the latest edition of our virtual health series for families. And today's topic is a big one. It's about COVID-19 vaccines and kids. The littles, the ones under the age of 5, can now receive their COVID-19 vaccines. Valley Children's began administering them last week. And we've got lots of questions from parents, and I have two great physicians here who can answer all of your questions. Joining us today, we have Dr. Karen Dahl, Vice President here at Valley Children's. She's also a board-certified pediatric infectious disease specialist. Dr. Dahl, good afternoon to you.
Good afternoon, Zara. I'm really excited to be here finally to get to talk about vaccines for our youngest age group, the only age group who had not been offered any protection by vaccinations up to this point. So I'm very excited for the questions and very excited that we were able to roll out the vaccine last week.
Right, thanks, Dr. Dahl. And we also have Dr. Haley Nelson here today, complex care pediatrician. Dr. Nelson, you also provide care to patients in our Charlie Mitchell Children's Center. And I'm sure you have been asked a lot from parents of younger kids, when can my kids get their vaccines? Yes?
Yes, so happy to be here and to answer parent questions. I'm a parent myself, so my toddler just got vaccinated and we were so excited, but this comes with questions. So I'm just happy to be here with Dr. Dahl and to answer those for parents so that they feel confident moving forward to hopefully be able to vaccinate these little ones.
So for the last week or so, we've been soliciting questions from our followers on Instagram and Facebook. And for those of you who are watching this live stream, please feel free to put any comments or questions in the comment section of this live stream, and we will try to get to all of your questions. But first things first, and why don't we start with Dr. Dahl for this one? The big question a lot of people have is, it's not really affecting kids, is it? Is COVID-19 still impacting kids? And if so, do they really need a vaccine?
So it's a really good question. And I think from the very beginning of the pandemic, the discussion was about elderly people being at highest risk. However, now that we've vaccinated everybody else, what we're seeing in hospitalization trends across the US is a higher proportion of young children being vaccinated, being hospitalized, than even older children who have received the vaccine. And so as the pandemic has shifted and our protection methods have shifted, the children are standing out a little bit more as having serious disease, needing to be in the hospital, needing to go to the emergency department. So although it's less common than it is in elderly people, it certainly happens. We see it happening here at Valley Children's.
Mm-hmm. And Dr. Nelson, tell me about some of the cases of COVID-19 you've seen in kids in your practice.
Sure, we've seen a wide variety. And so some children do have a mild infection, and some of our patients have ended up, like Dr. Dahl said, in the hospital. And this is something where for this younger age group, we haven't been able to protect them. And as the world kind of moved on, and when you go to work, when you leave your home and you come back with your small one, that they kind of were left vulnerable and exposed. So this is an opportunity now to be able to give them additional protection because they really deserve it too.
Dr. Dahl, in addition to your many hats you wear here at Valley Children's, you also help manage from the medical side of things our emergency response here at Valley Children's for the pandemic. You have been in these meetings that the CDC, that the FDA, that everybody's been holding since day one of this pandemic. So why don't you start with the basics here as to what was authorized for children who are 6 months to almost 5 years old? What are the vaccines available to them now?
So right now, we're authorized to give both the Pfizer vaccine and the Moderna vaccine, which are mRNA vaccines, to children 6 months of age and older. The newest data was for Pfizer submitted data for kids 6 months to 4 years because they had authorization for 5 and older. And then Moderna submitted 2 sets of data, one for children 6 months to 5 years and another for 6 years to 17 years of age. That data was delayed because they were gathering additional safety data about the risk of myocarditis because that had been a concern. So the Moderna authorization was delayed while they accrued a large amount of data, finding that really the risk is very, very small in this age group. So I'm happy that there was so much safety monitoring that went into this, even though it took a lot longer than we wanted. But that was because there were safeguards in place, looking to make sure we didn't have any unacceptable risks. And even for the Pfizer vaccine, it took longer than we had anticipated to get the data because they needed to do additional studies and make sure it was truly effective enough. And so they needed to wait for after the third dose to get the data that was needed. So Pfizer is approved for 6 months to 4 years in a series of 3 doses. Moderna is approved for 6 months to 5 years in a series of 2 doses. The caveat there is I would anticipate that Moderna will get an additional dose authorized as well.
It's a lot of information. And Dr. Nelson, you and I were all talking about this right before this Facebook Live started. Dr. Nelson, what advice do you have for parents who are like, this is so much to take in. How do I keep track of all of this?
It's so much to take in, like you said, because we've got different age cutoffs now. You have an option between Pfizer and Moderna. And so parents want to know, which one do I choose? Where do I go? Like it's great to have options, but then it provides you an opportunity to really kind of second guess or really evaluate what you want to do. And the main thing is to talk to your doctor. There are some nuances between the 2 vaccines. And if you're looking and trying to decide and you have that option, your pediatrician is the one who knows your child best. And we're here to be able to answer those questions, both by doing this Facebook Live, but also from our office. And so I really just want families to reach out so that we can help guide you to what might be the best fit for your child.
Okay. Thank you. Dr. Dahl, one parent asked, what are the ingredients of these vaccines? I remember when it first got authorized for us grown-ups, and we did one of these Facebook Lives, you had to do so many presentations saying, this doesn't alter your DNA. There are no microchips in here. So why don't we do just a little refresher course of, what are in these vaccines and how do they work? Especially, it's easy for us to get vaccines. When you think about injecting your children, you become maybe a little more cautious. So those parents might need a reassurance here.
So these vaccine formulations are really, except for the amount of mRNA, the same as they were for the rest of us who've been receiving vaccine for over a year now, right, in the pandemic, and millions of doses have been given. So the ingredients are the same. It's mRNA and then a lipid carrier made up of a bunch of different lipids. In the Pfizer vaccine, there are some salts, and then there's sucrose, a form of sugar. The Moderna vaccine also has the mRNA in a different dose, a different lipid carrier, but lipids, which are fats, and then a couple of other acetic acid, some sodium, and sucrose as well. So they're the same as the bigger doses for adults, but they're just less of the mRNA. Important to remember that these vaccines don't contain egg or preservatives or latex for people who have allergies or sensitivities to those things. And they're labeled differently for us to keep track of in the office in different colors because the mRNA dose and maybe the amount we draw up in the needle from the vial is different for different age groups. But it's very much the same vaccine except for the amount of the mRNA.
Thank you for that. Dr. Nelson, when parents take their kids in to get vaccinations, what can they expect as far as side effects?
So the side effects are generally pretty mild, if any, experienced by children. And one of the nice things that I like to reassure parents about is that it's a smaller dose. And so as a parent, if you got the vaccine and you might have felt crummy, that your child might not, because they're getting a smaller dose. Their immune system is just more robust, able to respond and give them that protection. But some children do have a sore arm. A few children might get fevers, be a little tired. For my own children, they were a little tired afterwards. We had an early bedtime at our house, And the next day they were full energy. So with the side effect of an early bedtime at the Nelson household, it seemed pretty good. But generally speaking, the side effects are small to none at all.
Thank you. Dr. Dahl, you mentioned some of the ingredients that some people might have allergies to. So for instance, you said, there's no egg in this one, or so sometimes people can't get the flu shot because they're allergic to egg. Besides being allergic to specific ingredients in either of these vaccines, one question that came up was, is there anyone who should not get the vaccine?
So other than someone who has an allergy, as you mentioned, to one of the components of the vaccine, and that's a serious allergy, then the other reason not to get the vaccine is if you have COVID right at the moment. So we don't want to immunize someone who should be in isolation, right? So they need to stay home in isolation. And then I would say other acute illnesses are just a little bit of a wait. We generally don't give vaccines in children in the middle of a high fever illness or something like that. So you've got a little bit of allergy symptoms, you may have a runny nose, I would say that's fine to go ahead and get the vaccine. You're sick, you're on antibiotics, you've still got fever, you're still laying in bed, that is not the day to get your vaccine. But there are very few contraindications. There are some precautions that we've learned about where you need to talk to your provider for sure about things. If your child was one of the children who had MISC as a complication, then there's some time period that needs to happen since the MISC before we would recommend the vaccine. Again, talk to the doctor about that. And children who have had myocarditis, either from the from COVID or from another illness, should also talk to their provider about that. But again, those are precautions, which means have a conversation with your physician about that. They're not contraindications.
So we're getting several questions coming in real time now based off of your answer. So let's say a family, the Rona came to their house. They all have COVID. How is there some immunity that they have a certain amount of time after a COVID-19 infection, or how soon should they get the vaccine? These kids, if they have no vaccines at all yet, how soon after a COVID infection can they get vaccinated?
So really, you can receive the vaccine as soon as you're over the acute illness and are no longer in isolation. And there is some immunity from natural infection, but we know that immunity doesn't last very long. And we also know that it may not be very good against variants coming down the road. So I would say for people who have had no vaccine, which would be this young age group, it's important to give them the protection of the vaccine and not wait. If you're in the middle of your vaccination series and you've had some protection and maybe you're waiting for a booster, say someone in the family, yeah, it may be okay to wait for a little longer, but to get people their initial vaccines, we shouldn't be waiting.
Okay. Dr. Nelson, you see a lot of children with medically complex conditions. These parents now, they have a lot of worries about all the medications their kids are already on. Now you're adding one more thing. What do you want to tell those parents? Is it safe for their kids with medically complex conditions to get the COVID-19 vaccine?
Yes, it is safe to get this vaccine. We have the trials to show us. We also have the benefit of being in June of 2022. So I really like to call out where we are now in the pandemic and show parents kind of the numbers from the older age groups of how many children have benefited from being vaccinated and how much safer it seems now when we're talking about our little ones, because we know more about the vaccines, how they work, and how we're really able to protect our children. When it comes to medical complexity and you're weighing out between, do I get the vaccine or do I leave my child vulnerable to getting COVID? We also know plenty about COVID to say that it's not a friendly virus, that children do get quite sick with it. And if you're medically complex, you're more likely to then end up sick enough and in the hospital. So this protection from the vaccine is all the more important for that child.
And that brings up another good point, Dr. Dahl. There are people who are arguing against it by saying, I could get vaccinated or I was vaccinated. I still got COVID-19. So can you explain a bit how this doesn't mean you'll never get COVID, but here's what it does do for your body and for you?
So I understand why people have that argument and are somewhat confused about why they should, because at the beginning of the pandemic, when the vaccines were rolled out, that's sort of what we thought. But we've learned a lot over the last 2 years. And one of the things we've learned is that this virus, like many viruses, constantly changes. And so it's hard to protect someone with a vaccine against getting an infection. However, the vaccines are really good at protecting you from getting really sick and needing to be hospitalized, or worse, someone dying from the infection. So we know now that although you're vaccinated, you might still become infected and you might feel crummy. You might have a couple of days at home where you really don't feel good, but the vaccine is going to protect you from being hospitalized and from dying. And so that's really the value of the vaccine.
No, thank you for that. Just speaking personally, my kids and I all got vaccinated last year, and every time one of us gets sick in the wintertime, we all end up getting sick, and we invariably end up with cold-induced asthma. We're on inhalers. Our doctors are like, don't want to turn to bronchitis. So we all got COVID when Omicron just raced through Fresno County, right? And the interesting thing is, I was fully expecting, here we go. I'm going to need a nebulizer again. These kids are going to, and it never entered our lungs. It stayed here. And I'm telling you, like, the littlest cold usually sends us to the doctor's office. So I'd like to think that that's the vaccine working, because none of us needed inhalers the entire time we had COVID. So to your point, seems like it worked.
Yeah, you had COVID, you got an infection, but you didn't get really sick. And that's the value of the vaccine.
Mm-hmm. No, that's good. Let's see, Dr. Nelson, is it okay? Because obviously when we announced this age group, a lot of parents are like, well, if anybody's going to give this dose to our kids, we want Valley Children's to do it. But talk to me about these questions people have. Is it okay to go somewhere else for your vaccine?
It is. You certainly, starting with your pediatrician as your medical home to see if their office has it, if they have appointments. We had our clinic this weekend that I know you were at, Sarah. So Valley Children's is offering clinics, and we'll be posting those as there's spots available. So myturn.gov is, .ca.gov. That is the website to go to kind of find other locations if you can't get it through your pediatrician. And then I actually really like our health department as a resource as well. So they have flyers, and they're posting where these clinics are at. So if there is one that is in your neighborhood and closer to you, if you aren't able to get in with your pediatrician, just kind of looking to see what your options are, knowing that there are some restrictions. So if you do have a little one, for children under 3, it gets a little more challenging for who can give them vaccines, just because, again, pediatricians were more comfortable dealing with babies. And so you might not be able to go to a pharmacy, but if there is a clinic that is posted, making sure that they're offering the age bracket that you are looking for before you spend the time kind of waiting in line when you get there.
Yeah, the age bracket's really important. California Department of Public Health doesn't allow the pharmacies to give vaccine to children under 3. So we know that it's going to be more important for primary care providers, vaccine clinics, here us at the hospital, to be able to really be there for those younger ones under 3.
And it's important to note, all of you, we don't treat kids like little adults. I mean, they're much different when you're practicing medicine to kids. So I know that Dr. Dahl, you've even had some partners in the community say, we want to get these doses out, but I don't know if we're necessary. None of these nurses are trained in giving vaccines to grown-ups, but maybe not a 6-month-old baby. So you're saying then in that 6 month to about 3 years of age, they can't go to a Vaughn's or a Walgreens to get their vaccine?
Correct. So, and pharmacies have been great partners in this pandemic in providing vaccination. And it's different state by state, but in the state of California, they cannot give vaccines in pharmacies to children under 3.
Oh, got it. So just blanket across the board, any vaccine?
Yes.
Oh, okay. See, good to know. Dr. Nelson, someone's asking, can you give this vaccine to your 6-month-old while they are still on their course of all their other vaccines?
Yes. So if your child has an appointment coming up for their 6 month shots, it is safe to give this vaccine along with the other ones. Early on, we had talked about, oh, do we give it at the same time? Do we need to space things out? And the answer is no. It is okay. Children, their immune systems can respond to multiple vaccines at once. And so if you have that appointment now, if you're looking at the calendar and you know that appointment, they're turning well, I guess for 6 months. So if you've got that scheduled, but maybe their visit isn't for a couple of weeks and you really want to get them vaccinated for COVID, that's where it is okay to call ahead to see if you can just get a shot visit or to look to other places. Because for some families, the longer you wait, so, there is that anxiety of leaving that child, at risk of getting sick. And so kind of paying attention to the timing of when that appointment might be so that we can get that protection started.
Dr. Dahl, someone just asked, if a mom was vaccinated while either pregnant or breastfeeding, should she still get her baby vaccinated, or does the baby have any type of secondhand or antibodies that are providing protection?
That's a really, really good question. And it's one of the reasons we try to make sure that pregnant women are vaccinated against a variety of things, including pertussis and COVID, because early on, the baby does get the benefit of some antibodies from mother, but those antibodies decrease over time. And by 6 months of age, we don't see those antibodies around much anymore. So mothers who had been vaccinated are providing some protection to that really critical period up to 6 months of age when there is no vaccine available. But then the vaccine or the protection from mother is really going away at that point, and it's important to get them vaccinated.
We're getting lots. Oh, sorry, Dr. Nelson, didn't mean to cut you off.
I was just excited to chime in on the breastfeeding aspect of that as well. So there's some moms who maybe were concerned and didn't get their COVID vaccine while they were pregnant, although that is preferred, again, because you're passing that protection to your baby. But if you have a baby and you're breastfeeding, that you're sharing your immune system, you are sharing some of those benefits. Now, one of the cool studies that came out actually was looking at when mom got vaccinated while breastfeeding, if she had side effects, did the baby have side effects? So if the mom had a fever, if the mom had a sore arm, was the baby more fussy? Did anything happen to the baby? And the answer was no. The babies were happy, they were feeding well, and they got that protection. So if you are currently breastfeeding and you have a baby that's under 6 months and you're not yet vaccinated, that really is an opportunity for you while you wait until your child's old enough to be able to get the vaccine themselves.
No, thanks for adding that. Dr. Nelson, the next question I had was for you too. How do you prepare obviously a 6-month-old or a year-old baby, you take them to the doctor, they're not going to know any different, but how do you prepare maybe your toddler or your preschooler for that appointment where now they see the needle coming into the room? How do you help prepare your kid for this?
Yeah, this is an interesting one that really you go by how old they are and how much they understand, and also your child's anxiety level. And so if you know that they're going to get more worked up about it, maybe we either talk about it longer, or if that's going to make it worse, maybe we kind of make it shorter. So kind of playing it out a little bit for how you prep your child. One of the nice things is that on our Valley Children's website, we actually have the social story, both in English and Spanish, that walks you through what it looks like getting the vaccine through our main clinic. So that's kind of a nice way of using that as story time, walking through with the little pictures of the teddy bear, what it's going to look like so that they're ready and that they know I say hi to the security guard and I'm going to wear my mask and what it might feel like. If you're going to your pediatrician's office, they're used to that. We know what going to the doctor feels like and what it looks like. And so you can prepare them there. And then I think as a mom or as a dad, when you're going, you pack your bag and plan ahead too for you have some extra snacks. You make sure that your devices are charged or that you brought a book or something to keep them occupied, whether it's because you're waiting in line. So sometimes there's a little bit of a wait. And so if that's the case, you want to keep them occupied so they don't get a little stir crazy while they're waiting. And then afterwards, we also want to monitor to make sure that everyone does well. And so there's some wait time there. So knowing that it's not just okay, I got my shot and I leave, planning ahead, having those extra snacks might save you some parent sanity.
No, those are good tips always, especially to charge those devices and maybe give a little more screen time than you normally do. Dr. Dahl, someone just wrote in, Okay, family is now all fully vaccinated. The adults are all boosted. Do families still need to mask or take extra precautions after everyone, including their little ones, are fully vaccinated?
So I think that depends on the situation. Certainly, you don't need to do those things in your own household if everybody in your household is fully protected with vaccination. But I think there's still risk. We know people can still get infected, although they're not as likely to get very sick. So I still recommend masking in indoor places. I know I'm one of the few people in Fresno doing that, but I'm still masking indoors because I don't know the vaccination status of everybody around me or their health status. And indoors is a bigger risk than outdoors. So I think everybody's got to look at what your own tolerance for risk is, right? So some of the things we know that are risky, it's riskier to be indoors. It's riskier if it's crowded. It's riskier if there's eating and drinking. So those are things that you may want to weigh. An outdoor birthday party at the park sounds pretty fun to me, an okay activity right now. Going to the zoo sounds very safe right now. And then again, it just depends on the status of your household and your children. If someone in your household, whether it's a child or an adult, has a complicated medical history or is immune compromised, they're more vulnerable. So you might take a little extra steps. If everybody's completely healthy, you might just take the usual steps.
Okay, and this is for either one of you. Shifting gears slightly to the 5 and up group. What's going on with boosters? Are kids supposed to get boosters? Who can get them? That question did come in as for like which kids now qualify for boosters.
So that's a question that's been coming up in my office a lot for these children that we got them vaccinated. Now there's a booster and they're eligible, and maybe families weren't aware of that time frame. And so I constantly, if you call Charlie Mitchell Clinic and you are seeing me for any number of reasons, I always check your vaccine status because it's hard to keep track of all of these different numbers and timeframes. So when it comes to the 5 and ups, there's a 5 month wait from their initial series to then that booster. And so making sure, again, we want to kind of charge up that battery. We want those cells to remember that job. And when we think about how the vaccine works, that it targets that little spike. And so if it sees that spike on that little COVID spiky ball, it says, I don't like you, get away. And over time, its effectiveness and its ability to do that kind of decreases. And when we get the booster, it says, aha, I remember, I don't like you. And so that's what we want to do with the booster shot, and making sure that if your child's eligible, they get it so that they're able to have that benefit and that protection.
Okay. So we are getting a lot of questions now about the schedule. And this is something we were also talking about because it's different from adults. It's different from the 12 and up. It's different from the 5 to 11. So I'm going to call this up. Dr. Dahl, if you don't mind walking us through this document.
And so as Sarah mentioned, not only is it, oh, it's not my favorite document, but we can go through it.
Sorry, did I call up the wrong one?
So there are lots of different ways you can go through it. And one thing to remember is it's different between Moderna and Pfizer. It's different if you're immune compromised or you're not. So right now for Moderna, up to the youngest ones, they really are only getting 2 doses unless they're immune compromised. And by that, we mean significantly immune compromised. So again, your doctor, you should be talking about that. You probably have a specialist if you're that immune compromised. So those would be the people who would get 3 doses for Moderna. And that's true all the way. Again, the next age group that you have down there is also Moderna. And again, it's 2 doses and a 3rd dose only if they're immune compromised. Something to call out on this table, we're looking at, for most people, and it says dose 1 to 2, and it says at least 4 to 8 weeks. So that's really interesting. The 4 weeks is the minimum interval. And you can delay that 2nd dose up to 8 weeks. And there are two reasons to think about doing that. One reason is that in countries that had delayed immunization, the second doses due to supply early in the pandemic, when they delayed it, looking back, they had a better immune response when the doses were delayed in time. So you might get an overall better immune response by delaying up to 8 weeks. The other thing we know about that, and I would say this is especially true, not for this youngest age group, but maybe for adolescents through young adults, is that also by spacing out the vaccine, there was less of that small risk of myocarditis. So those would be the people who should think about spacing it out to 8 weeks. The people who should not space it out and really go at the minimum interval, anyone who's immune compromised. We really want them to get as much protection from the vaccine as quickly as possible. So they would not be recommended to space anything out.
We're calling up a different graphic that might make it a little easier for people to read. And that is something, okay, let's see if this is a better one.
That's my favorite.
Sorry.
This one is
what happens when I do it live and I'm trying to do two things at once. So Serene behind the scenes, thank you for calling it my bad. Oh, this is a lot less confusing than the one I was showing.
Yeah, this is my favorite one. This is available on the CDC website. So when we're off live, you can find it there for yourself and print it up. But you can see then the Pfizer for the different age bands. And again, Pfizer goes at the 3-week intervals as the minimum interval. Moderna goes at 4-week intervals. And you can see that the Moderna up to 17 years of age only is a 2-dose series. Pfizer up to everyone really is a 3-dose series. I wouldn't count on Moderna staying a 2-dose series. We're waiting for more data that they will be submitting. So it may end up that Moderna will be a 3-dose series. But for right now, Moderna is complete at 2 doses in that age bracket. Although when you get to 18 and older, there's a booster dose. Mm-hmm. And then there's another booster dose. If you're 15 or older, it's impossible for anybody to keep this all in their head. And so this graphic I like. It makes a lot of sense. It's easy to follow. And so again, it's at the CDC website. If you just Google CDC at a glance COVID, you're going to get this and you can see right where you need to be. The second page of this document is for people who are moderately or severely immune compromised. And again, people who fall into that category generally have a specialist taking care of that immune compromising condition. And so it shortens the intervals. It doesn't give you that time frame to say, oh, you can go, up to 8 weeks. No, they want you to get it right away as soon as you can. And then there are additional booster doses for people who are immune compromised. So I think this is the best graphic I've seen lately to really help people understand where they are. And you can look at your vaccine card and see if you're eligible for another dose, and you should get in there and get your second or third or fourth dose potentially.
So going back up to the first page of this, when you are talking about Moderna and Pfizer, there was some chatter last week about there are some kids now who've been holed up for most of this pandemic who are now ready to go to school. And so there are a lot of parents who really wanted Moderna because it's a 2-dose regimen that will get them fully vaccinated before kids start school. But if you get Pfizer, by the time school starts in August, theoretically, you'll have 2 of the 3 doses. Dr. Dahl, is that enough protection for those kids, or should everybody try to get Moderna?
So I think that when I heard all the data that was presented at this ACIP meeting of the CDC, that for Pfizer right now, we know that really 3 doses is going to give you the best protection. And Moderna at 2 doses gave really good protection. We don't know how long that protection lasts and if that 3rd dose is going to be required. And I also don't like the headlines that were out there that said, one was 80% and one was 30% effective. These are totally misleading numbers. When you look at the data as a whole set of data, it's very complicated, and it depends on what you call effective or not effective and how you slice and dice the data. After listening to 2 days of the ACIP meeting, I really felt that the vaccines were equivalent and that Pfizer or Moderna would be fine. And that wasn't the impression I had from the headlines before the meeting.
Well,
But listening to it, I really think they're equivalent. And if people ask, which one, I think like earlier in the pandemic, which one is available to you is the one I would get right now. And then I would say, families may have some preference based on how their experience with one or the other vaccine had been.
Oh no, thank you for that. And Serene, thank you for finding the right graphic. This is why it's great to have a great producer who saves your butt when you're calling up the wrong graphic. So thank you for that. Dr. Nelson, something that Dr. Dahl said that I feel is important for parents to hear is whatever is available to you is the best option. Why don't you talk a bit about that? I know that you've had to communicate that out before to some of your patients. J&J is not even in the picture for this one, but when it comes to Moderna and Pfizer, what do you want to tell parents who are really worried maybe about which one they should get?
Yeah, they've studied these extensively. So I agree with Dr. Dahl that they're really either one is a good option, and getting your child started towards the protection. It's interesting. You mentioned the whole thing about school. And if you get Pfizer, knowing that you've got to wait until after that third dose, we need 2 weeks after that until it's really, at your peak for effectiveness. And so, yes, Moderna gets there sooner. If your child gets Pfizer, that's fine. They're still going to be protected. But be mindful of the fact that while you're waiting for that third dose and that time afterwards, that they're not there yet. And so this is where we need to make some decisions about what activities you're up to this summer and what exposures your child has. And even with starting school, depending on, again, where they get their vaccines, which one they have, and that timing. So there's a lot to all of this, which, again, has made it really complicated. Those graphics, I appreciate that they are simplified. I would say the other thing to parents is if you are scheduling your child, so your 6 months to 5 year, or anyone else who's starting their series, to go ahead and schedule the subsequent appointments. So that's one of the nice things if you're doing this through your pediatrician's office or whatever clinic you go to, if they already know when the follow-up clinics are going to be, so you have those dates so that you complete the series, because it's not going to help you if you don't actually do all of the doses as part of that series.
All right, no, thank you for that reminder. Dr. Dahl, someone just asked, do you foresee a partnership happening between Valley Children's and maybe school districts, hosting options with little ones for vaccination to help support if there's growing demand in the future here?
So I would say I always see partnerships to help children on the horizon if it's necessary or helpful, right? So again, these are kids who are not yet in school, many of them, this age group. So finding partnerships of where we would best serve the community. And maybe it's with the public health department, their mobile vaccine clinic. It may be at WIC offices. It may be a variety of different places where we had partnered with schools quite a bit in the past throughout the country because it was a school age vaccination. And now this is not quite the school age vaccination. So we really need to just think about where can we best capture these children and make it most accessible for families to get the vaccine. So I think partnership is something we're always looking at. I know we're already talking with Madera Public Health Department and their vaccine clinic, their mobile clinic. And so we're definitely looking towards that. I'm not sure how big a role that the school system will have to play in this, though, because of the age group.
Yeah, no, that's a good point. And for those of you who are watching this right now, our teams did partner with Tulare County, with Cutler-Orosi Unified to try and get vaccines out to places where maybe there aren't as many doctors or clinics. And so, yes, we are always looking for opportunities to partner where and when we can. We're getting a lot, I think probably because people missed the beginning. So if you don't mind, Dr. Dahl, going over again, what are some of the side effects that you might see in this age population after the vaccine, in case they missed it earlier?
I'm not even sure we covered all of that, so that's fine. We definitely talk about it, and I think that's a big question everyone's going to have. And interestingly, these vaccines, the COVID vaccine, the side effects are not dissimilar to the side effects you would see to other vaccines we give in this age group. They happen in the same time frame and about the same duration of symptom days. So very minimal symptoms, I would say, and similar to other vaccines for this age group. So sore arm, yes, that can happen. That can happen with any vaccine. Redness and swelling, not as much as maybe some older people saw. It is possible that there could be some swelling of the lymph node around the area, and that would not be a negative thing. That's not bad. It's not anything to be concerned about, but if you find a bump there, that's probably what it is, and those go away. And then other things that they found is tiredness. So for a day or two is possible. Crankiness, again, if you've got children who've been vaccinated with anything before, those are things you may have seen. Fever is possible, not 100%, not nearly 100%. So less than half the kids, significantly less than half had fever, but you could have fever, usually low-grade fever, 99 to 100 degrees, and decrease in appetite. I would say those would be the biggest things that were called out in the studies that they found. But again, pretty minimal symptoms and really comparable or less than other vaccines in this age group.
Okay, good to know. Dr. Nelson, if a child is cranky, maybe is tired, has a low-grade fever, what kind of treatments can you offer to help comfort your kid, make them feel better?
Sure. So first and foremost, just some snuggles can go a long way, especially with this age group. So some extra cuddles. They might, be more willing to take a nap. My toddler certainly has given up nap time, and post-vaccine, she actually took a nap. But then the next day, we're back to no naps. So, it's very temporary there. If they are complaining, so if you do see that they are kind of irritable, or that they do say that their arm hurts, or you're worried about them, so if your child's not able to communicate that and it's something that's concerning you, you certainly could give them a dose of Tylenol or ibuprofen. So either one of those are safe options to give to manage some of these mild symptoms that they might experience. But again, not all children do. And so I think just knowing that it could happen and being prepared, just like how you are for, as Dr. Dahl said, after any of their other vaccines. And so knowing how your child typically responds and kind of expecting that with this one as well.
I know that one of our teammates also shared a story. Her 2-year-old recently got his vaccine, and one of you asked, well, did he get cranky? Did he get tired? And she said, I couldn't tell if it was 2-year-old crankiness or vaccine crankiness. So other than that, she said her little one was okay. So and it's interesting because I got nailed after. I felt so tired after my vaccines, but both my kids, one felt a little tired and the other one was like, stop asking me, Mom, I'm fine. I feel fine. So to your point, Dr. Dahl, it is interesting how the younger age groups seem to be responding pretty well and feeling it a lot less than, we might have. Okay, so I think we covered all of our questions. We did have a Pfizer clinic on Saturday here at Valley Children's. The follow-up for that one is 3 weeks from 2 days ago. And then just to let people know, we will soon be opening up a Moderna clinic, a Moderna vaccine clinic. This is for Saturday, July 9th. So not this Saturday, but next Saturday. So look for that opening up soon in MyTurn. As Dr. Nelson said, it's myturn.ca.gov. Just do a Google search for MyTurn and you'll find it. We cannot schedule all of these, so it's got to be through MyTurn. If your child is seen at one of our primary care practices, they are also, Dr. Dahl, they're running now, right?
Yes, they are.
Okay, so we are also offering the vaccine at our primary care clinics. But again, as Dr. Dahl and Dr. Nelson both said, check with your county health departments. Other pediatricians' offices are opening up their offices for community clinics. So just check MyTurn, and anytime you have any questions, ask your doctor. They're used to questions from overly concerned parents. Dr. Dahl, before we go, anything else you wanted to add for those people who are watching right now?
I think that this vaccine has gotten more attention than any other vaccine in my career. And so we all know so much more about how vaccines are tested, how they're approved. We hear so much more about the data. And so I think the transparency around vaccine And the process has been really good, and for everybody to understand the value of the system that we have and the monitoring that goes on. The other thing I would add is I think part of that system for COVID has been vSafe, which is that app you can do on the phone. That's available for your child too. You will do it for them, obviously. And so sign up for that in that 15-minute waiting period after you get your vaccine, and that will help make sure that we've captured all the side effects, and we just learn more and more about vaccines as we gather more information. So that's really important, and make sure we're capturing everything.
All right. And Dr. Nelson.
Yeah, it's been really interesting joining you, Zara, for these health series throughout the pandemic. I agree with Dr. Dahl. I, have learned so much about the vaccine process and all the meetings that go into it that they didn't teach me in medical school. So it has been a learning on the job experience, but I've also experienced this as a parent. And I have to say, one of the patients that actually the parent asked me in clinic about, well, were you nervous? And if you think about being nervous as a parent, like that's our job, to worry about our child and the choices that we make. And that this is a choice to make to be able to really help your child with their health. And if you have questions, that's why we're here doing these Facebook Lives, but that your pediatrician's available. And so I would encourage parents, like, ask your questions, make sure you get them answered. That's what we're here for, because we really want to help support you for being a parent and protecting your child.
Right. Fantastic. Dr. Nelson, Dr. Dahl, thank you. Everybody else, you can go to valleychildrens.org/COVID-19. So valleychildrens.org/COVID-19. We have a plethora of resources there, including answers to your most frequently asked questions. And this will also be reposted later on our social media channels, so you can watch it again, share. We'll also be doing one in Spanish too, coming up in the next few weeks. So again, Dr. Nelson and Dr. Dahl, thank you for your time, and thank you for watching. Stay safe, everybody.